So you want to know all about hypertension and the best way to prevent it, right? Well, you're not alone. You all remember Wangchuk and Nana, right? Good, because they will both be taking us on the prevention of hypertension journey. Wangchuk will first define how normal blood pressure works in the system and what a high blood pressure truly is. In order to survive and function properly, your tissues and organs need the oxygenated blood that your circulatory system carries throughout the body. When the heart beats, it creates pressure that pushes blood through a network of tube-shaped blood vessels, which include arteries, veins, and capillaries. This pressure, also known as a blood pressure, is a result of two forces. The first force, called the systolic pressure, occurs as blood pumps out of the heart and into the arteries that are a part of the circulatory system. The second force, called the diastolic pressure, is created as a heart rests between two heartbeats. These two forces are each represented by numbers in a blood pressure reading. A high blood pressure is when your blood pressure, the force of your blood pushing against the walls of the blood vessels, is consistently too high. Causes could be age, ethnic background, family history, temperature, obesity and overweight, sex aspects, physical inactivity, smoking, alcohol intake, high salt intake, high fat intake, mental stress, diabetes, psoriasis, and pregnancy. Now, how do we recognize the signs and symptoms? Well, Alejandro will be taking us through the signs. Most people with high blood pressure will not experience any symptoms at all. It is often known as a silent killer for this reason. However, once blood pressure reaches about 180 over 110 millimeters of mercury, it is considered a medical emergency known as a hypertensive crisis. At this stage, symptoms will likely show, including headache, nausea, vomiting, dizziness, blurred or double vision, nosebleeds, palpitations, and/or breathlessness. If the hypertension is not treated or controlled, the excessive pressure on the artery walls can lead to a damage of the blood vessels, also known as cardiovascular disease, as well as the vital organs. The extent of damage depends on two factors: the severity of the hypertension and how long it goes on for untreated. Examples are stroke, heart attack, and heart failure, blood clots, aneurysm, which is just a dilation of blood vessels, kidney disease, thickened or torn blood vessels, metabolic syndrome, brain function, and memory problems, just to name a few. Treatment for high blood pressure depends on several factors, such as its severity or associated risk of developing stroke or cardiovascular diseases, and etc. Chris will now be taking us through the different medication therapies available. Now, there are 4 major groups or families of medications that could be prescribed. The first group are the angiotensin converting enzyme inhibitors. Now, I know that is a mouthful, but Chris will explain what this means. ACE inhibitors, what they do is they block the action of some hormones such as angiotensin 2 that regulate blood pressure. Angiotensin 2 causes the arteries to constrict and increases blood volume, resulting in increased blood pressure. So we need to reverse this action. Examples of drugs that do these actions are enalapril and losartan. The second group are the calcium channel blockers. Among other things, they are known to decrease the calcium in blood vessels, and so a drop in calcium relaxes the vascular smooth muscle so that it does not contract so strongly, resulting in the widening of arteries. If the arteries are wider, blood pressure will drop. An example of a drug that does this is amlodipine. The third group are the thiazide diuretics. They act on the kidneys to help the body eliminate sodium and water, resulting in less blood volume. Less blood volume results in lower blood pressure. They are often the first choice in high blood pressure medications, but not the only choice. An example will be hydrochlorothiazide. The fourth group are the beta blockers. Now, they slow the heart rate as well as reducing the force of the heart, resulting in a drop in blood pressure. Examples are metoprolol and atenolol. Now, wouldn't it be better if you could just take control over your own health? What if you had the choice between medicinal and non-medicinal interventions, with your physician's approval, of course? I'm sure we would all opt for the second choice, right? Nana will be taking us through the non-medicinal interventions. Exercising for 30 to 60 minutes 5 days a week will usually lower a person's blood pressure by 4 to 9 millimeters of mercury. If you embark on an exercise program, you should see the benefits fairly soon, within a matter of 2 to 3 weeks. It is important to make sure you check with your doctor before embarking on any physical activity program. Exercise needs to be tailored to the needs and health of the person with hypertension. The secret of getting success out of exercise is to do it regularly. Exercising at weekends and doing nothing from Monday to Friday will be much less effective. Studies have revealed that even moderate weight loss, just 5 kilos, can have a significant impact in lowering elevated blood pressure. If you are overweight, the nearer you get to your ideal weight, the more blood pressure is likely to fall. Any high blood pressure medications you are taking will become more effective when you lose weight. Reducing your waistline will have the greatest effect. Achieving a healthy body weight involves a combination of exercise, good diet, and at least 7 hours good quality sleep each and every night. Managing the diet can be an effective way of both preventing and treating high blood pressure. This means eating plenty of fruits and vegetables, good quality unrefined carbohydrates, vegetable oils, and omega oils. If you eat animal products, make sure all the fat is trimmed and try to avoid processed meats. Also think about lowering salt intake. Studies have shown that even a moderate reduction in salt or sodium intake can lower blood pressure levels by 2 to 8 millimeters of mercury. Lowering alcohol and coffee also has a significant impact on your blood pressure. So what did we learn from today's class, Raj? Lifestyle modification is indicated for all patients with hypertension, regardless of drug therapy, because it may reduce or even abolish the need for antihypertensive drugs. In addition to the immediate goal of lowering blood pressure, the recommended lifestyle changes may grant a range of health benefits, including better outcomes of common chronic diseases. So all in all, do what it takes to start to have a healthy heart. And as interesting as that was, do keep on watching as the next episodes will be about diabetes and exercise. And if you happen to miss the previous episodes of healthy eating and obesity, then do check that out too. Until then, see you in the next one.